right, so this is the video to just give you some tips for your med admin. So there's a couple things that we're going to do over here in the med room, and then we're going to go over to the patient's bedside to show you the rest. First of all, whenever you do use the hand sanitizer, you do need to make sure we need to see, sorry, it'll squirt sometimes a little bit, but we need to see it go onto your hands, and we need to see you rubbing it in. So you can't just say, I will wash my hands, and you can't just act like you're pumping it. Okay, so every time, any skill that you do, you need to actually wash your hands. The other thing is, when you're looking at orders, you need to look through the orders, order tab to verify the order. So you're not gonna verify orders on the MAR. So just make sure you're looking at the orders. And this is where you don't have to write down every medication. You do have to note that they are complete and active, okay? So for the medication, you need to look at the label that's actually on the medication itself. So there's a medication on the bag, and there's a medication or a label on the bag, and there's a label on the medication itself. This is what you will use to verify the medication. When you get in the patient's room and you're scanning, you're still going to do all your checks with the medication itself. So looking at the label, comparing it to what the order says, okay? But when you go to scan, the reason why we have it in the bag and the scan part on the bag is because you do need to scan here, because that actually lays flat. So if it's on the bottle, and we don't actually have barcodes on the pills, but you will look at the pill for the information about the medication, but the scanning part happens on the bag, okay? So you will need to verify that and state that if the medication needs to be held, and that's based on the last set of vital signs and what the specific details are for that medication, and you will need to state that. If a medication is going to be held, you would need to state that to your faculty and why the medication would be being held. You'll do your first and second checks over here in the medication room. And the first check is just when you verify, you've gone through the orders, now that you go to the MAR and you will verify what meds you're giving for that particular time. The second one is when you're checking again to make sure, again, looking at the information that's on the actual physical medication and verifying that with the MAR. You can do your dosage calculation at that time. That would be my recommendation, but again, that's your choice. Because really, honestly, you would need to do it here to know for your injections, to know what size syringe to get. But if you forget to do it there, you can always do it at the patient's bedside. Just know that you may have not chosen the correct syringe. So again, recommendation is that you do it on your second check. The third check happens at the patient's bedside. Once you go into the patient's room, we'll talk about all the beginning stuff, but just know that you've got your medications here in the bucket that you brought with you. You can certainly leave that on the bedside table, but remember, you don't have to watch them the entire time, but you have to know where they are, and you can't ever leave the room. Maybe you did get the wrong size syringe. Maybe you didn't get an extra needle to change out for your IM injection, whatever it is. If you have to leave the room to get more supplies, get a pair of gloves, anything like that, you have to physically take this with you. So the medications just have to be with you. So that doesn't mean you have to watch them like a hawk. They're going to be here on the table and certainly out of the reach of the patient, but you cannot leave them in the room and leave the room and then come back. If you do have to leave the room, and that's the only way that you're going to be able to complete the tasks, by getting the proper syringe, by getting the extra needle, whatever you need, you settle the patient back down. If you have raised their bed, you properly leave the room by washing your hands, leave, go get what you need, and when you come back, you enter the room just like you did at the beginning. So remember, when you do come into the room, you can set the medications down, but you're going to go ahead and wash your hands. We need to see you physically wash your hands. And then you are going to come over to where the patient is, okay? So if most of the time, I think we're gonna allow the patient to already be pulled up, but you can ask, can you tell me your name, that kind of stuff. But if you don't have the chart actually pulled up, you have nothing to compare it to. So it's really important that before you do the full identification of that patient, you have the chart pulled up. So you can do, you are checking the name and date of birth in 2 different ways, and you're using the patient and you're using the computer. So your hands are clean, so you're looking at the armband, you're asking the patient, and then you are comparing it to the chart. This is really important. It's a really good habit to get into very early so that you make sure that everything matches up. As soon as you have done that, then you're gonna grab the scanner, and then after you have done that full identification, then you will scan the patient, okay? And then it will make a little notation here that the armband was scanned. So another little tip, you certainly don't have to do it, but my recommendation would be then to pull the table around to the side of the bed. If you'll notice, just underneath when you do this, the trash can will come with you, because there's little legs that kind of hook this way under the table. And then you can adjust the table up to a height that's comfortable for you, and make sure that the trash can is accessible so you can get rid of your supplies pretty easily. Okay. Another thing with injections is every syringe will have a safety feature. This one is one that kind of flips up over the needle when it's given. And so it's very important that after an injection is given, that, and this will be discarded, after you give the injection and you're pulling out, you are going to cover the needle with the same hand that you gave it with. So you're not reaching across to cover this needle and possibly sticking yourself, and you're not moving this to the other hand to then push it up. This hand is out of the question. So if you really think about it this way, this hand has been pinching or pulling, so let it just stay there until this part is covered. Snap it into place. This other hand can grab a piece of gauze to put over the top, and then this goes in the sharps. Okay, so the one-handed cover of the needle is very important. After you have cleaned the site, after you've told us where you're going to give it and shown us where you're going to give it, then you will clean the injected pad. So, and this is true for any injection that you give, you are then not going to touch over that site where you have cleaned. This is the same if you're doing an IV as well. So wherever you have cleaned, you're now not going to come back and touch over that site. So just be really careful when you pinch or when you pull to do your injections, that you're not pulling over then where you're going to give the injection. So you wouldn't bring your thumb across this way and hold it. So you're just going to come down on the side. Both injections that you're going to be giving will be given at 90-degree angles. And just kind of get this straight in your head. You are going to pinch for sub-Q. You're going to pull that modified Z-track for IM. You are not going to aspirate with sub-Q. You are with IM. So whenever you come and practice, make sure that you're doing that every single time so you don't forget that. Okay? After you're done administering all of the medication, you're basically just going to pack it back in your little bucket here. This will be in the sharps container, and then you will basically just take these right on out of the room with you, and then we will kind of interact with you as faculty. Okay, but before you leave the room, there's several things that you need to do. You can move the table back around if you care to, or you can just move it to the back. You will state, I'm going to make sure the bed is at the lowest position. You can even check on the side. I'm going to make sure the 2 side rails are up. I'm going to make sure their call light is within reach, and that they know I'm coming back to check on them in just a little while. And then I'm going to make sure the last thing that you do is make sure that you wash your hands one more time before you leave the room. And then that will end the interaction. Okay.